So please talk a little bit about the medical and the cultural differences that have resulted in this divide. And we know that in America, it looks like the CDC is going to be much more coming out in support of masks.
The first thing is that I do not want to be dogmatic. In fact, there are a lot of scientific research going on trying to address this question whether wearing of surgical masks are really useful for protection in a community setting. But I must say that the bitter experience of SARS in Hong Kong in the year 2003 has taught us a lot of lessons. The first thing is that we in Hong Kong are really very densely populated. Where our office, our home, everywhere, even in public places, is very crowded. And it would be very difficult for us to do very effective social distancing. In fact, most of the time you can't really separate yourself from other people by 6 feet. And as a result, even in the year 2003, a lot of people are masking themselves in order to protect themselves from getting SARS in that particular year. And of course, we also have to learn from past experience with other acute respiratory virus infection, and especially from influenza. If you read the literature on influenza, especially those systematic analysis, it shows that surgical masks do have an effect even in a community setting. Of course, it has effect in the healthcare setting, but even in community setting, we all know now that wearing a mask did reduce the risk of getting infection in either a community or in a university setting. And especially that after you stop using a mask and just do hand washing, the effect of protection is markedly decreased. And so in Hong Kong, this is not a difficult, I must say it's easy to ask people to wear a mask. But in a Western setting, it's quite different because wearing a mask is a sign that you must be ill. So people tend to refuse the use of mask. But I think at the present situation where the pandemic is galloping, I do think that especially in the urban setting where there are a lot of people coming together, it is really important to have everybody getting a surgical mask to protect yourself and to protect others. And I do think that the changing stance of the US CDC is a wise way to go. And I do believe that not just in crowded places, but even in less crowded places, when you contact people, when you have a very high density of infection in community, surgical masks do help.